Now we're moving to kidney illness. In kidney illness part, we discuss 3 illnesses. One is enuresis. It is a pretty common illness for the children. So pediatric, the children pretty easily, or sometimes people say waiting bite. Second illness, second illness, generally say mostly happens in the children. It's a kind of weakness condition, weakness condition. Edema sometimes also happens in the adults. Now we're talking about some infant or children's edema. So that's 3 illness, pretty commonly in children when they have problems, relationship with the kidney. Let's talk about one by one. So the first one we're talking about is enuresis. For Chinese name, Yi Niao. Niao is urination, is pee. Yi means they didn't know when it happens. Mainly it happens during people's sleep. And then have like a urination or have pee. So that's the result get waiting back. So that's the first illness. So that's why we say what is yours? What is yours? So that's usually we're talking about children waiting back. Usually we're talking about over 5 years old. Small children, certainly they couldn't control their urination. So up to 5, up to 5. If they still like get pee during their sleep, then we talking about enuresis. If under the 5, 2 or 3 years old, follow they grow up, they will fix the problem itself, not necessary for the treatment. So that's we talking about. So that's kind of involuntary kind of control for the bladder and passing the urine when they sleep. They don't know. They don't know. So that mainly happens at night. So this condition or this problem, some children maybe it's mild condition. It's not that severe. So they may happen like twice a week or 3 times a week. So occasionally happens. Occasionally happens. And some children or some patients, they may very severe kind of condition. So like every night, it will be happen. So that's totally depending how severe of the problems. And some case, like they are pretty short time, then they recover. Some case maybe for the problems for a few years. And especially occasionally some adults, they still have this trouble, but not that common. Usually like over 5 years old, and some people can go to 10 ages. Most people, like after like 15 or 16, they will be fixed. But still, occasionally some patients, even the adults, still have this trouble. So that's the problems. Yeah, that's the problems. Then we're talking about etiology of the enuresis. Means what caused the problems. So basically, we still not that totally clear from Western medicine aspect. But something may be relationship with enuresis, like a genetic reason. So if the family member they have a history for the enuresis, like the father or grandfather, so mainly their children have more chance get enuresis. So that's generally say, but truly some other reasons still relationship. Then we talking about the prognosis of the enuresis. So generally say, if the children occasionally have wetting bed, it's not that big issue, especially when they're young. Even we're talking about 5 years old should be normal control. But some children maybe like 6 years old or 7 years old, they still couldn't control. But when they grow up, gradually, they will be recovered by themselves. So that's we say about 50% of the patients, that means over 5 years old, 5 years old already, they can recover. Yeah, they can recover without treatment. And the other patient, after treatment, they still most part still recover. Only about 1 to 2% of the patient they may still have the trouble. So that's for the like originally some patient have enuresis problem. If the adults like they totally recovered already, and then they got enuresis again, that's basically caused by some other illness. But truly, for some adults, they may just like continually from the young and then still for the adults still have this trouble. So generally speaking, wetting bed for children is not a big deal. And we say most patients they will be recovered by themselves, even without treatment or with the treatment. But truly, it may cause the children some depressed, like they are pretty shy. They're pretty shy. They don't like other people know they still waiting by, or maybe cause them depressed. So that's the mainly things we need to thinking about for writing by or yourself. So that's generally say. And we say enuresis can cause by different reasons. We are not totally clear yet right now. but one of the reasons is genetic problem. If the enuresis caused by genetic problems, that's usually difficult to treat or difficult to recover. So that's the generally, but mostly they will be recovered. Then we still especially talking about the TCM etiology. 先说 for TCM etiology, we still thinking about some congenital kind of difference. That's one of the mainly reasons. And also people getting sick for long term make their body weaker. That's another reason. And also some damn heat accumulations that still can cause the problems. And also may have some other reasons we put together for one category here. Then we go to some detail one by one. We talking about a congenital kind of difference first. So that's generally body weaker. People originally have body weaker. That's usually relationship with kidney. Kidney essence and kidney qi difference in there. So that's our yuan qi in there kind of a difference. And that kind of difference causes some, like we're talking about kidney qi relationship with kidney yang. Kidney yang warming the body, yeah, follow all over, warming the body. When kidney yang qi difference, some difference cold will be inside. They will not able to warming the bodies, and certainly they will not able to warming for the blood. So that caused the bladder couldn't holding the urine and losing their functions, then caused the enuresis. So that's genital defense, mainly relationship with kidney. Genetic reason. When we talking about some people, like they don't have this trouble before, or kids don't have this trouble before. But after some illness, then they have this trouble. So basically, people have severe kind of illness. Not all the illness will cause the trouble, but truly, like a severe kind of illness and a long-term kind of illness, they will cause the lung qi and the spleen qi difference. So lung qi and the spleen qi control the all over body qi, and like spleen TNT functions, transforming qi nutritions to all over the bodies, and the lung qi regular the water passage. So they both regular the water passing the way. When they lose this function, like the water don't know where to go, they couldn't control, they couldn't hold it. Then enuresis happens. So that's long-term problems. And also kidney still the reason. Yeah. People have long-term problems, still damage kidney and then still lending dysfunction of the blood. So that people follow the illness also cause. And also sometimes some food can generate like some damp heat condition internally. If eating too much, cause the accumulations of damp heat. So these kind of damp heat, they may blocking the liver channel. Liver channel go to genital area. So that's basically liver mainly function, moving qi, shu and xie, and moving qi. When liver channel blocked, and then caused some heat generations, and if especially go to the bladder, like can pushing the urine go outside. We say heat moving upward and moving outward. It's kind of more moving. It's not like a cold contraction. So like pushing the urine go to outside. Then urine happens. So that's the third mainly reason. And we also have some other reasons. Other reasons, firstly, we're talking about maybe training. Yeah, maybe not like enough training for the children. Even in the daytime, yeah, even in the daytime, we are not like totally suitable training for the children. Their children don't know how to control their urine. Like even in the daytime, they pee everywhere. And in the night, they sleep. They are not get up. So sometimes even they wake up, they have pee, they still don't thinking about to washroom. So that's one of the reasons. Another reason is parasite infection. Before midterm, we especially talking about pinworms. Pinworms, they producing the eggs, especially go to aunt's eye. So that's stimulation in the aunt's eye. It's so close to the urethra area. So some stimulations go to urethra. So how we like go to pee. Sometimes we feel we have some urine in the blood. So that kind of stimulation, just like people feel some urine in the blood, then they pee out. But they didn't get up to pee out. They waiting back. So that's TCM etiology we're talking about cause the enuresis. Then we're talking about the TCM pattern and the treatment. The first pattern we're talking about the low originality difference code. Basically, that's the same meaning, yin-yang difference. So the symptoms, yeah, key symptoms, patients writing bad. This kind of patient writing bad is pretty frequently. and clear kind of urination, big amount. With a severe kind of case, they may wetting bed every night. So for these kind of patient, even few times each night, so you can know how severe it is. Like they never get up go to pee, but they always have night urination, but just wetting bed. So that's just if we separate the local symptoms here, or mainly symptoms for enuresis. The other symptoms, that's generally relationship with yin yang. So generally tired, fatigue, and pale face, cold limbs. Cold limbs 出来 is yang deficiency symptom. Pale face is deficiency kind of face. Fear of cold, same meaning, aversion to cold. And generally weaker, especially lower limbs, that's usually kidney control. The tongue is pale, still deficiency kind of tongue, or cold kind of tongue. Pulse deeper, internal disorder, serrated is deficiency. Or deeper, slow. Slow means cold. So these pattern pretty common pattern, usually caused by congenital kind of deficiency. And also can happen with the people getting sick for long term and didn't recover totally body weakened. So that's the first pattern we're talking about. So treatment principle, cold we need warm, and kidney deficiency we need a tonified kidney. So tonified kidney, yang, and help the patient holding the urine. When we're talking about enuresis, we have a special points for this condition, enuresis. We call 遗尿点. We're talking about the 遗 before already. Like you forgot something or leaving something somewhere. 尿, your, or pee. 点 this point. So these points specially treat enuresis conditions. So 遗尿 is the enuresis. So it located right on the center of this small finger joint here. So that's specially treat enuresis points. So basically, we need all these points and keep each time maintain the needles about 15 minutes, once a day, and every 2 days. You can use 7 times as one section treatment, like we talked about before. Then stop a couple days. Then start another section to see. So any kind of pattern, people have this trouble, we can go to these points. Yeah, we can pattern points plus these points especially. Then we're talking about some other points here. Generally, qi 25 points and warming. So that's 220. 220. We're leaving some yang qi there. And ren fo. Ren fo is can tonify yuan qi, originally qi. And ren 3, especially we can treat bladder problems. So we can do both. And 3-6, 3 meridian meeting part. So basically working for 3 meridian. And certainly you can modify the from there. So we're talking about if patient more fatigue. And also with clear urination. So that's basically we can add in bladder 23, kidney 2, or even 2-4, especially for kidney young. And even with warming needles or marks on there. And the kidney 3, yuan south points of the kidney. So the points above, especially 220, ren 4, ren 3, spring 6, we needle it. We can use warming needles or maybe needle first, then with marks. So like we say treat once every afternoon. Because enuresis especially happens in the night. So we especially pick up the time, afternoon, close to the children's sleep time, even better result. So that's especially. So I think that's a little bit hard to tell patient special time go to clinic. If we can pick up time, the best time for this condition, 5 p.m. to 7 p.m. This time not only close to children's sleep time, also that's kidney time. So kidney disorder, if we especially go to kidney time, even better result. So that's the first pattern. These two pages the same. Then we're talking about next pattern. Yeah, next pattern. Next pattern, mainly qi deficiency. All over body qi control. This one is lung, one is spleen. Yeah. So we put lung qi, spleen qi deficiency together here. Clinically, maybe one organ qi deficiency is more severe compared with others. But we just put it together here for simple. So still key symptoms in enuresis, but it's not that big amount. We're talking about a scanty amount, but the time is kind of frequent and generally weaker. Yeah, generally weaker breathing, and don't like to speak. That's mainly relationship with lung qi deficiency. Poor appetite, losing slow. That's mainly relationship with spleen qi deficiency. Spontaneous sweating, generally qi deficiency. Tongue is pale. And maybe large in tongue with and tender and also possible with this mark because spleen T and T not working. Generally say weaker pulse. So that's the mainly T deficiency pattern. We need to tonify T and consolidate the urine. That's the mainly problem. So the points, mainly points, basically pretty similar. Pretty similar. That's still T tonify points, and the local points go to the bladder there. And certainly we can add in more points, like a patient mainly green tea deficiency, poor appetite, or losing stool. We can go to factor of the bladder, factor of the spleen, bladder 20. Certainly, if a patient more show up for lung tea deficiency, you can go to factor of the lung, that's bladder 13. So you can just modify the formula. We have some basic points there, and then you can modify the formula. Then we're talking about the damp heat in the liver channel. Damp heat in the liver channel. So basically still wetting bad, but still not that big amount. But the urine is yellow kind of color in there, and have stronger kind of smell, stronger kind of bad smell in there. And also this kind of patient may have generally pattern symptoms, so like pretty easily angry and irritability. Or for the children, sometimes they talking during the sleep. That's still kind of heat sense in there and couldn't holding sense. And also maybe grinding tea. Mostly people grinding tea for TCM relationship with liver gallbladder. And sometimes people have sleep problem, like don't want to sleep. So that's still heat. So tongue and the limbs are red, and the yellow or greasy tongue coating. So greasy tongue coating is the dampness of lung side. Yellow is the heat side. Pulse is sleepy pulse. Sleepy pulse still dampness of lung side. Rapid still heat. Forceful. That means this pattern is the excessive pattern. Excessive kind of damp heat accumulation. So our treatment principle, certainly we need soothing the liver qi and clear heat and try to fix the problems in your case. So for acupuncture, we keep some basically points here. And then we got some points. Go to liver gallbladder, clear heat in the liver gallbladder. Still treat in the afternoon. And also we can modify it from there. Sometimes children They are not get up, go to pee, just because they have so deep sleep. They didn't wake up. Yeah. So that kind of condition, we can add in 四神聪 nursing for 神 like a 神脑的出来 control all the body functions. And also for frequent urination, couldn't hold in there, still kind of T deficiency. So we still can add in T points there, do 20 and then 6. So that's we can modify from basically like a point there. When we talking about parenting, so we say some children they waiting by because they just don't know need to go to pee, go to washroom. So training, regular training, even during daytime, from pretty early stage. So generally speaking, after 1 year old, you can do some training, start some training already. And gradually, like children have good habit, and they know how to like avoid to wetting bed. They wake up during the night, they go to sleep, then they go back to sleep again. So that's basically. And also we say sometimes, like they play too much in the daytime. They are tired. They are pretty easily go to pretty deep sleep, and they didn't wake up. So basically, just don't like people too tired during the daytime, and then they can wake up, not go to very deep sleep there. And also encourage the children sleep by themselves, So that's they like some like habit there. They know they need to get up. They know they need to go to washroom themselves. So that's some parenting here. And also you can add in another one here. Try not to drink too much liquid like water before they sleep or in the afternoon time. Yeah. Don't drinking too much. We know when people drinking a lot of water, they truly pee a lot. And if they couldn't wake up itself, certainly they will wetting back. So try not to drinking too much right before the sleep, or in the later afternoon. So that's some preventing. So they put the drinking part in the nursing care part. So basically the same. So decrease the liquid intake few hours before sleep. And also for the food, don't put too much water in the dinner time food, in the dinner time. And certainly after dinner, don't drinking too much. And training for the children before they go to bed, go to pee first, and then go to sleep. So that's some we need to be careful. Still kind of preventing, And training the children, training the children. Tell them like go to pee regularly and empty their bladder. And if they have some like pretty shiny or anxiety, just try to relieve. You can just tell them it doesn't matter. You are so small, so young, when you grow up, it will go away. But we still keep treating. But don't put pressure for the children. If the children waiting bad, and you always say, "Oh, why you still waiting bad? You are 5 years already. You are 8 years already." They will more shy, and they will more depressed, anxiety. So that makes the problems even worse. So just say, "Oh, it doesn't matter." So relieve some anxiety, relieve some pressure for the children, but just more training for them. Then gradually, the problems will be over. So that's basically. And certainly impatient enuresis caused by some other issue or some other illness, we need to treat like the illness caused the enuresis first, and then they will fix the problem. So that's basically for this illness